All right, Lindsay, we are going to go ahead and proceed with your back examination this evening. Now, I have you in for a very basic examination of the spine as well as the skin of your back. So this is going to be a bit of a hybrid exam where I am looking at the overall structure of your bones. I'll be having a look at the scapula alignment as well as the spine to ensure that there are no areas of concern or any signs of distension specifically along the spine. I want to make sure I have a pretty thorough look there. I'll also be having a look at your rib cage as well as hip placement and alignment. So aside from that, I'm going to be doing an overall dermatological inspection of your skin, assessing for any abnormalities in skin texture. So just a good once over for you this evening. Now, I'm going to begin by just straightening your shirt slightly here so I can better visualize bone structure and symmetry. So having a look at general scapula placement as well as scapular indentation and proximity to the other side. So looking for any areas that appear misaligned visually. Also looking at the rear of your rib cage, noting placement here. So just going to assess your breathing for a minute and notate any abnormalities from one side or the other. So far seeing equal rise and fall of the rear chest wall here. So I'm just going to hold my hands down here and feel for your respirations. Noting symmetry, not feeling any crackling or any signs of abnormality at the lung, so that's very good news. Okay, so I'm just going to go ahead and expose starting at your lower back, so I'll be working in smaller sections here. I want to have a look at the small of your back, assess for any abnormalities of the skin texture to begin with, which so far is not notable. I do see one small freckle here that I will have a closer look at. Second noted here. So moving up to the mid-back. Again, small, what looks like a mole there, so I will definitely be assessing that in further detail. So lastly, just raising up to the top here. Very good. Okay, so I'm just going to grab my grabbing my Penlight so I can do a bit of a better visual inspection. So I'm going to look at the overall skin texture, not noting any signs of particular abnormality there. Okay. A couple very small freckles are noted. Nothing that appears concerning in color or shape, so very round and symmetrical, light brown in color, no signs of asymmetry at the edges or any darkening, so that's very good news. Those are the markers for concerning moles, so I'm not seeing anything that I would say is worrisome. Once again, just noting rib placement, so looking at the side closest to me, comparatively here, very even symmetrically. I'm going to go in with my calipers and measure for symmetry. Now, these are very cold. I do apologize in advance, but I'm just going to be measuring from mid-back to right at the lateral line of the rib cage there, so about even spacing. Just going to compare that to the other side. The waistline here. Maybe slightly offset right there, so about mid-back. Okay, and then lastly measuring from pelvic bone to tailbone. Now I do like to measure just about the length of the mid-back. And then diagonally as well. So far everything is looking fairly symmetrical. No signs of any major discrepancies, which is wonderful news. Okay, so I'm going to go ahead and put a pair of gloves on so I can perform a bit of a palpatory assessment. So give me just 1 second. Now, I'm going to start with very mild palpations. So you're going to feel just the tips of my fingers kind of gently gliding over your skin. And I'm just starting with an introduction here. I just want to feel for the space in between your ribs. So very gently palpating for that cartilage in between the bone here. So I'm going to feel diagonally. Just noting normal placement here. Same thing on the other side, essentially looking for any differences in the spacing between your rib cage. So if I did note any abnormality, it could indicate that there was something more concerning at bay, but so far all of this does feel fairly normal. So just feeling around, again, diagonal palpation along the rib cage. I'm going to feel now, starting at the top of the spine, so just following down, so I'm not feeling any abnormality at the spine. No signs of abnormal distension. I'm going to do a bit of a deeper palpation below the rib cage, so feeling for your abdominal organs. Again, looking for any signs of abnormal distension or tenderness. Of course, if any of this should feel uncomfortable, please do let me know. Just ensuring there are no signs of acute abnormality here at the lower quadrant. So same thing on the other side, of course. Does feel okay. Move into some spinal percussions here. Now I have a reflex hammer that's going to allow me to tap along the bony prominences. So you're just going to feel a light percussion along the rib cage. Of course, let me know if this causes you any pain or if you feel any tenderness. Use the smaller side here to tap along the spine directly, and of course just let me know if any of that is painful or if you feel like tingling sensations along the spine, particularly at this lower region. Very good. So I just have my thermometer here, and I do like to test for any signs of abnormal temperature variation, specifically at the lower quadrant. Anything that could indicate any signs of abnormal inflammation or something that we maybe should pay a little closer attention to. So I'm just going to scan a few different areas. I do see one area of slight abnormality here at the scapula. So just feel around here. Look for anything notable. It does feel slightly warmer. Not necessarily feeling any signs of inflammation. Directly along the spine. Very good. So the only area of abnormality was here at the scapula, and I'm not feeling anything concerning there. I will go ahead and percuss just to ensure I didn't miss anything here. So just let me know if you feel any pain here. Test for any signs of underlying inflammation here. So I have this tool that allows me to apply very mild pressure to test for reactivity, and I don't see any signs of delay here, so that's good news. I'm going to test that along your lower back as well, so just along that upper quadrant, and then I'm going to follow the hip bone, looking for any signs of indentation here. Very gently testing along the spine, being careful not to apply too much pressure. Now, just apply my caps here and just slight stretching of the skin so I can assess for any concerns in skin texture. Very slightly abrasive, so I do apologize for that, but it shouldn't cause you any pain. It just allows me a bit of traction. Overall skin texture does appear normal. I'm not noting any elevation at the surface of the skin. No signs of any dermatitis or psoriasis, no underlying eczema. Very normal variation here. It does appear slightly raised, but definitely not concerning. Further testing along the spine. Just feeling for anything here. I want to do a very brief test for your neurological response. Now you have several nerves in your back that will allow me to test for normal brain function and essentially just looking for a particular response in the reflexes in your back. So I'd like you to just relax for me, try to allow your body to just rest naturally as I test these next few things. Now the first thing you're going to feel is very cold, so just to give you a warning, it is going to be quite cold on your skin, okay? So just going to start here. And testing for bilateral response. I'm noting slightly diminished reactivity. I'm going to go ahead and test that with the secondary tool. Now this one is slightly more distinct, so you're going to feel a very sharp sensation. It shouldn't cause you any pain. Barely touching the surface of the skin, just looking for that normal reactivity, which is notable. So definitely getting more of a response with our second tool. Using my hand to test for our softer sensation. Palpate around this one particular area where I see a very slight abnormality in skin texture. Don't think it's anything concerning. I just want to make sure that it's not anything underlying that could be causing it. So just feeling this one area. I'm going to feel hip placement here. Stand for a second and just assess overall alignment of the spine. Not noting anything abnormal there. Placement is in line. Normal curvature at the base of the rib cage. Overall skin health is hydrated. Skin is dry to the touch but does appear well moisturized. No signs of excess dryness. Overall hair distribution is normal. So just percussing once again along the spine itself. I'm going to have one last look, make sure I didn't miss anything. I'm also just going to have a look underneath your clothing, make sure there are no notable imperfections here. Slightly darker at the top of the back here, which is normal with sun exposure. We tend to get more sunlight up at the top of the back versus lower, so just gonna have a look up here and make sure that I didn't miss anything. So same color is even with mid-back. Scapular alignment is even as well. Cervical spine is intact. Okay. All right, Miss Lindsay, we have completed your basic spinal examination today. I didn't note very many abnormalities, a couple normal variations. Nothing that I would say is concerning, nothing notable really. The few moles that you have are well within normal limits, nothing concerning. I will say that you have some slight sun exposure at the top of your back versus the lower. It can be a little difficult to apply sunscreen on ourselves, but if you plan on being outside for extended periods of time, I would recommend asking someone to apply sunscreen for you or investing in a spray that you can apply topically. It's a little easier to reach. Aside from that, I would say everything is fairly normal. I didn't note any misalignment of the spine itself. Respirations were well within normal limits. Palpation of your organs did not note any abnormality or signs of distension. So overall, you're in very good health, and I would say we are probably good to go for another year. Of course, if you should feel anything abnormal come up prior to, you are welcome to make an appointment and we can have you back in. Okay? Otherwise, I thank you for coming in and I look forward to seeing you at your next appointment.